Thank you very much, Miriam. I was actually messaging our participants just to let them know we will get started as other participants join. So good morning, afternoon, or evening, wherever you're joining us from. On behalf of the GNC, I'd like to welcome you to this webinar on advocacy for resource mobilization, which is the third and last webinar of the 2024 series of resource mobilization webinars for local and national actors launched by the GNC in June. The webinar will be held in English with simultaneous translation in French, Spanish, and Arabic, thanks to the support of our great team of interpreters who will be facilitating this. As we can see from the next slide, to access interpretation, please click the global icon on the bottom of your screen as shown in the slide. The guidance is provided in the 4 languages, but if you need any support throughout the webinar, please feel free to reach out to us using the chat box. So I hope that you can manage to access interpretation. And before we introduce the agenda for today's webinar, I'd like to share some background on this initiative, particularly for local and national actors who did not have the opportunity to join the first 2 webinars. So this series of webinars was launched by the GNC in June this year in collaboration with local and national partners, but also funding partners to enhance the resource mobilization skills of local and national partners to increase their access to direct global humanitarian financing. This initiative, as we can see in the presentation, aligns not only with the global localization commitments, but also with the GNC localization frameworks and priorities, which are presented here. That includes the localization roadmap, which was launched earlier this year, and also our resource partner engagement action plan, which was also released this year. So as we can see from the next slide. Yes, can we move to the next slide, please? So as we can see from this slide, global humanitarian funding that is provided to local and national actors accounts for less than 5%, even when we combine both direct and indirect funding flows, as shown in this chart. This is very far from the groundbreaking target, which calls for 25% of global humanitarian funding to be allocated to local and national actors. So to address this gap, the GNC has launched this initiative, and with this initiative, we hope to provide a space for learning and exchange among local and national actors on not only the challenges, but also solutions and opportunities and strategies for LNAs to access direct humanitarian financing. So far, we have held 2 webinars before our webinar today, which counted with the active participation of almost 350 partners. So following the first 2 webinars, which were focused on the overall nutrition in emergencies, financing landscape, and key elements to build funding, quality funding proposals, we're hosting this webinar today, which will focus on advocacy for resource mobilization. As we can see from the next slide, this topic was selected by the local and national partners who joined us in the first 2 webinars through a poll that we conducted, and advocacy for resource mobilization, as well as the second topic, the topic of the second webinar, were among the top 5 topics selected and prioritized by local and national partners as the main areas they wanted to explore further to enhance their resource mobilization skills. So this initiative is being organized in close collaboration with local and national partners from Kenya, Uganda, Venezuela, and Yemen. And we have also counted with the collaboration and support from the GNC Advocacy and Communications Working Group partners, including Save the Children, Catholic Relief Services, Nutrition for Development, and the civil society network of the Scaling Up Nutrition. So the objectives of our webinar today are to share global strategies and best practices in advocacy for local and national partners to enhance their strategic donor engagement, but also to mobilize resources for their nutrition programs. The second objective of this webinar is to provide a space for peer-to-peer exchange among local and national partners on key initiatives that have proven successful in advancing local and national partners' advocacy and resource mobilization for nutrition programs. So I'd like to introduce you now to our group of distinguished guest speakers and facilitators from the GNC, UNICEF, and local and national partner government and non-government entities, which are presented in this slide. So the agenda that we have today is currently displayed. Following this short intro, we will have a first segment, which will focus on global best practices, on advocacy, on successful advocacy for resource mobilization. And the second segment will focus on country experiences, where we will have the 4 countries that we have just introduced, sharing their experiences and impactful advocacy for resource mobilization initiatives, which can hopefully be useful to support other local and national actors seeking to increase their and diversify their funding bases. So following that segment, we will open the floor for an interactive Q&A, and we will invite partners to ask questions and share contributions. We will have 15 minutes for this segment, and before we reach that segment of our webinar, partners who are joining us today are also welcome to share their questions or contributions using the Q&A box. So now, without further delay, I'd like to open segment 1. Next slide, please. And I'd like to invite Magdalena Mactes from UNICEF's Office of Emergency Programs to share some global insights into what makes an advocacy strategy successful. Magda, you have the floor.
Thank you very much. Thank you, Stephanie. Greetings to everybody. I'm really thankful for the opportunity to share this webinar with you. As Steffi has introduced me, I'm Magdalena Mactes, and I'm a diplomacy, advocacy, communications, and partnerships professional with more than 15 years of experience working both for the private sector and in humanitarian and development programs at local, national, regional, and global levels. For the languages of this event, although I will speak in English, you will be able to exchange with me in the Q&A section at the end of the presentations en español. Podemos hablar en español ou en français aussi, si vous voulez. Then for this first segment of the webinar, as it was announced, I will talk about global successful advocacy strategies and best practices that are meant to enhance donor engagement and resource mobilization for nutrition in emergency programs. So a change strategy to mobilize resources, that is what advocacy can be. Because now I'm working for UNICEF at the global level at the Office of Emergency Programs headquarters, I will share from this experience in shaping a global humanitarian advocacy strategy for the organization. So what do we want? Talking about this specific webinar, we want to improve resource mobilization strategically to bring positive change to a group of population. We need, for that, an advocacy strategy. Why? Because advocacy is a preferred change strategy to build positive change with donors towards the end state or goal that we have as organization or program. Like, for example, if we want to improve the nutrition of children living or going through a humanitarian emergency, we want to pass from an actual state to an end state where the situation is improved. And this is a change strategy. And we want to co-create this strategy with donors. So how do we build it? And that is what you can see on this slide. Creating an advocacy strategy is a process, and where we start by analyzing the situation, doing a situation analysis, and identifying the problem or problems, and defining the advocacy priorities. That is the main topics, themes that your organization or program will want to advocate for to achieve that positive change that you're aiming for. So to give a little bit of context very quick, for UNICEF, to have a humanitarian, in this case, advocacy strategy was needed because of the global escalating humanitarian crisis. This has underscored the need to have a more structured approach to advocacy, a more coordinated approach, and this was aimed at securing a better response to the change we want to see for children. And so while we are now in the process of building the strategy, I can already share some of the lessons learned and recommendations. We can pass, please, to the next slide to talk about already challenges and lessons learned. So to use advocacy as a change strategy to mobilize resources, one lesson learned is from start, it's a very useful thing to map the accountabilities and capacities that you have within your organization or within your network of partners. Why? Because this can help you assess what are your real capacities moving forward and have a realistic planning from the beginning that will then be key to then define clear accountabilities for the implementation of the strategy. Of course, have a timeline. I mean, plan your strategy with a clear series of steps and realistic intermediate and end goals. This timeline, although you have to try to have it from the beginning, you will need to think that this will need to be readapted on the way according to your stakeholders' situations. So I would say a lesson learned is it's better to work together with your partners, with your stakeholders, than to be on time, but walking alone and not being so connected with the rest of your stakeholders. So from there, I will pass to what I think it is, for me, the most important lesson learned, which is build close relationships with your donors or potential donors. I mean, this is key because beyond all the best practices, and of course, the quality of all the work is the threshold. You want to start by having the best quality possible. But building a human relationship goes a very long way. I will put a quick example. I have experienced this a couple of weeks ago when someone in my team organized a meeting with one of the country donors to our programs that was visiting the town. So we did an in-person exchange, face-to-face, and it doesn't need to be in person. You can do this also by video conference. But just taking the time to build a report and share human to human the points of view, it can make you advance enormously because you can realize what are the common points that you have with your donor. You can put, the donor is also a person, or persons that form an organization, and they have preoccupations, challenges. By sharing this, you realize what are your common goals, and you share human to human. And this way of building the relationship is key to understand how you can work together and how you can give value to the donor in a meaningful way. Then related to that is, of course, build narratives that are not centered around money. Because if you want to touch stakeholders, creating this human-to-human link, then the money, let's say, will follow. So it would be to avoid repeating all the time the same key messages like we need funds, but be sensitive to what stories, what situation touches you and also touches them. So you listen to them and you can then build a narrative. So building on that, just to close, the recommendations to mobilize resources at a global general level would be the following. To apply a rigorous theory of change. I mean, in this, you have to be rigorous to really go through the process of applying the theory of change to the advocacy strategy that you're going to build to really envision what is the positive change that you're aiming for. And the capacities and resources, of course, that you need to do that. Another key recommendation for me is use evidence, because when you use evidence to develop your argument and your narrative, you give a level of, you build a level of trust that you can't build without those key informations. Related to that is also the fact that if you provide compelling and tailored content, you will make it easier to build this report and to grow the relationship with the donor. I mean, tailored content, that is, you will develop a strategy, an advocacy strategy, and you will develop a general narrative. But each stakeholder is different. So if you want to tailor the content to each stakeholder, the relationship will be more relatable and personal, and it will bring a level of trust again that will only grow. And for that, how do you do that? I mean, it's being a good listener, as I said, and prioritize human interaction that will bring to the table what we have in common, because we want to co-create with the donor. We want to work together towards the change that we want to see. Another recommendation is, many times when we're talking about emergencies, the stories that we want to bring are quite tough. But even if they are tough, if you spread positivity, even when talking about the hardest realities, you will be seen as an agent of change. And then to close, I think what we want is to generate. I will wrap up what I was saying. I mean, you want to generate a positive change with the donors. In other words, you want to build trust. And building trust is a key strategy for mobilizing resources. And with that, I thank you very much. If you have any questions, I will be happy to answer them by the end of the second section in the Q&A question. And I leave you to the rest of the speakers. Many thank yous. I think you're muted.
Yes. Thank you very much, Magdalena, for those very valuable global perspectives, especially for reminding us of the importance of not only seeking funding, but really seeking to cultivate strategic partnerships with donors, which is really critical to secure sustainable support for our country partners' nutrition programs. We will now move to the second segment, which will focus on country advocacy initiatives led by local and national actors from the countries we have introduced: Yemen, Kenya, Uganda, and Venezuela. We'll start with Yemen, and we'll now invite Abdul Kawi Hajar, Localization Program Manager at the Tending Youth Foundation, to take the floor to share some successful advocacy and resource mobilization strategies of the localization and optimization response mechanism initiative in Yemen. Abdul Kawi, you have the floor.
Thank you so much. Hello, good morning, good evening, good afternoon to all of those participating. Thank you so much for the Global Nutrition Cluster for having us on this chance. Happy to be with you and sharing our experience from Yemen. I am Abdul Gawi Hajib, the Localization Program Manager at Tamdin Youth Foundation, the Localization Initiative in Yemen. The Localization Initiative in Yemen is a movement by the local actors to optimize, to promote the localization agenda in Yemen and to raise the voice of local actors and mobilize for the funding and also transforming the response system in a context like Yemen. The localization initiative started on August 2021, and right now we are about 70 members from diverse sectors, including national, local actors at the province level, also at the national level, from women-led organization, disability, and so on. Our goal is to promote and advocate for the localization and application of the Grand Bargain agenda, and also for any other agenda globally or locally raised. what we have done up to date, we started with building a network of local actors. This network is for the advocacy and also learning what is localization. So we can advocate with the donors and intermediaries, UN, and so on. We have built a roadmap for this purpose. Localization strategy for Yemen. This is a national roadmap for the localization in Yemen, and it was built in consultation with the diverse actors in Yemen, including the government and the private sector. In Yemen, there is a unique or something different context for localization. So we included the private sector as well as worked with or consulted the diverse actors in the government or in the diverse governing bodies in Yemen. Also, we collaborated and coordinated this this initiative with global network or regional network that advocate for localization, such as ICPA, NIR, Charger for Change, PINRO, and also connected with the Grand Bargain. Also, we tried to search and look for another solutions for funding the humanitarian and development action in Yemen, not only depending on the donors or the governments that donate to Yemen response. So we started with the private sector. The private sector is a great chance for, or a great, maybe it can be a great resource for funding the response. So we conducted analysis of the role and the engagement of the private sector in Yemen and developed a guideline of how to engage the private sector in the response and how to make use of the power of the CSRs of the private sector in the response. And also we explored other other techniques for sustainability of resource for the response in Yemen context. One of them is the social investment. We also piloted one project or some projects in this regard, as this is a new concept in Yemen of how can NGOs or non-profit organization make investment and sustain their resources, whether for the response or for their sustainability. These are some examples of the results or achievement we have done right now. The factors that helped us to succeed in this is the engagement of stakeholders, not only the local actors, but also the collaboration and complementarity with other actors, global actors like ICFA, NIR, and also connection with the Grand Bargain. This helped us a lot to raise our voice and also to learn about localization as it was for us as local actor before 2021 as new concept. So the collaboration of with the diverse actors like IGFA, NIR, helped us a lot, and we could succeed, in fact, in what we have achieved. Also, this helped us to reach donors and raise a voice not only for one organization or for one type of actor, but as we build a roadmap or advocacy strategy, we could reach with clear advocacy objectives to the donors and convey the voice of all or most of the actors, including the government bodies, also the private sector, their perspective on the response in Yemen, and also this is applicable, of course, to the NGOs and also to the international NGOs. The other thing, successful factor is exploring in innovative resources mobilization as solution for the decrease of resources, and also as a solution for the humanitarian needs in context like Yemen. It's not helpful to stay in the same way of response or in the same approach of response, to stay in the emergency situation for a long time. So this helped us a lot to explore alternative solutions for resources sustainability, and also these resources can provide solution in the context of decrease or abandon of funds from donors. So these are the private sector engagement. Also, the other innovative resources for fund like social investment and other techniques we are exploring, like community participation in the response. Please, the next slide. So these are the most successful factors helped us, and the challenge, of course, we faced a lot of challenge. Science, this is a new concept for us. The localization, it was a new concept for us in Yemen. Just most of the NGOs or local actors knew about it recently. One of the challenges we still face, or we faced and still facing, the decrease of funding to the local actors in comparison to international actors. Of course, there is a challenging context in Yemen regarding the risk to shift resources to the local actors. but in fact, there is no most the solution by the international actors to solve this is still not that big one, or that can solve this problem and optimize the capacity of local actors to absorb all these resources, or to be able to receive high volume of resources. So this problem is still with just 2% of resources, direct funding to local actors in Yemen, to the local NGOs, and this is so low amount or volume in comparison to what committed in the grand bargain of 25 or 25% to be directed to local actors, but we couldn't reach this. Since the grand bargain, and we are in only about 2%, and most of the fund with the international actors, in fact. Also, there is a big gap in coordination of response and also engagement of other actors that can provide a good solution for the response in Yemen, or in context like Yemen, it's the private sector. Stay, in fact, up to date, private sector is not connected to the response, in fact, or the engagement of private sector is so much low, whether by the international actors or whether by local actors to reach and establish partnerships with the private actors to get resources. This problem is one of the challenges for the response in Yemen. Also, the big challenge for us as local actors in Yemen is the huge amount or volume of needs. Every year, the humanitarian response plan is not covered, or this year, for example, only 47% is met of requirements, or 47 are not met or covered, including water, shelter, and nutrition, and so on. So there is a big or a huge need, and this provide pressure on local actors to respond. Also, the advocacy barriers, low or weak capacity of local actors to advocate and to network and collaborate between them to advocate for localization, and also with international networks and actors who are advocating. So these are the most, or the key challenge we face. What we need to overcome this challenge, we need a more data-driven advocacy, and also to connect with global platforms, and to amplify the voice of local actors. Also, we have to explore alternative solutions. For example, the private sector, and also the social investment. These are good opportunities for resources compensation in case there is no or decrease of funds by the donors. We recommend also to all actors, whether in Yemen or out of Yemen, to overcome this challenge. Maybe these challenges are applicable in everywhere, not only in Yemen. To advocate for localization, not separately, to establish and build networks for advocacy, not just by organization or individual organization or individual initiatives. Establish networks in your countries and between yourself, and connect with the global advocates or advocating networks. A lot of chances or a lot of global networks emerged, and you have to build national networks and connect with global networks. Also explore alternative solutions for funding. Don't stay connected only to donors. There are a lot of opportunities if you are exploring around you. For example, the private sector, the other social investment, the community participation, and so on. Also, we recommend you to make the private sector as target for resources and for advocacy for resources. And also this social investment, you can find the good practices, and also to apply in your countries or in your organizations as alternative solutions for resources decrease or for sustainability of your organization, to be able to sustain and advocate for resources and respond to your communities. So thank you so much for listening and for having us this chance to share our knowledge and learning from Yemen, and we'd be happy to answer any question if you have. Thank you so much.
Thank you very much, Abdul Kawi, for sharing those very useful recommendations from the localization of response mechanisms in Yemen, not relying on intermediaries and leveraging corporate sustainability and social impact investments are key strategies that other local and national partners joining us today can explore to diversify their funding sources. So thank you very much for sharing Yemen's experience on this area. We will now move to Kenya, and I'm pleased to give the floor to David Halake, County Nutrition Coordinator at the County Government of Marsabit, to share Kenya's experience in strengthening country government systems to manage and scale up multi-sectoral interventions for greater nutrition outcomes. David, the floor is yours. I'm just going to remind you to please keep your presentation within the allocated 10 minutes. Thank you. Over to you.
Thank you very much. Thank you, Stephanie. Greetings to everyone. My name is David. I'm from Kenya. Receive greetings from Kenya. I work for the local government of Marsabit, the county government in northern Kenya. Kenya borders Ethiopia to the north. So I'm presenting, these are personal experience working with the local communities and all the partners in this area. Is an experience from the field, working with the community in Marsabit and Isiolo. So it's a case of resource mobilization for multi-sectoral humanitarian response between the year 2021 and 2024 in Isiolo, Marsabit County, Kenya. This is these two counties, Isiolo and Marsabit, are two counties among 47 counties in Kenya. And these are areas which faces challenges in the humanitarian context, a very fragile area in the global context of transformation of climate change, This area experienced 5 consecutive failed rain season, total crop failure during this period, and also in the same period is a period that we experienced COVID-19 pandemic, locust infestation, insecurity, resource-based insecurity, and also significant food consumption gaps and unacceptably high acute levels of malnutrition within the population. And this community is also dominantly pastoral communities, comprising 80% of the population being pastoralist, and they experience 50% loss of livestock, acute water shortages due to failed rainy season, and total crop failure. Due to this, we did advocacy for resource mobilization for response to save life, restore dignity, and also enhance resilience of local communities so that they can overcome the challenges that are posed with different dynamics, including other shocks like cholera outbreak, measles outbreak, and other diseases that occurs in this community. Please go to the next slide. So due to this advocacy, one of the key results that we saw is improved funding for nutrition intervention for these local communities. One of the things that we saw is an incremental allocation of resources in the government development plan. Particularly for Marsabit, we saw over 95% increase of allocation for nutrition funding as a result of nutrition advocacy that we conducted over this period. And also similarly in Isiolo, around 97% increment over 10 years. Resource for nutrition improved from about $296,000 to about $12 million allocation of budget for Isiolo County. And also similarly for Marsabit, from around $2 million, about $2 million to about $45 million allocation in County Integrated Development Fund. This is one of the documents that is used for resource mobilization by the government. It's used for prioritization of activities. And if activities are indicated here is activities of focus for government, and these advocacies enhance this, and we were able to capture all our plans in County Government Integrated Development Fund over years. And also as a result of advocacy, we have seen improved surveillance to inform evidence-based programming. One, availability of resource enhanced surveillance, and again, availability of evidences from our surveillance system enhanced our funding mechanism, because we use this for planning and also for indicating the need for resource to government and all the stakeholders within the country and also in the county. And these plans also help us to come up with anticipatory plans in a scenario where we are seeing from the data early warning information that there is likelihood of situation will be worse. We use those information for advocacy, and it enhances also resource allocation, resource availability from different stakeholders who are engaged at the local level for development and also for response action during the difficult times. And also during this period, we saw improved nutrition outcomes, both for Marsabit and Isiolo County. Particularly for Marsabit, the acute malnutrition levels improved from critical levels of 19.6% to currently 13.5%. And this was enhanced through joint actions, joint planning, joint advocacy activities that made sure that the resources are available, and we had different interventions that enhanced our capacity to respond to situation and also enhance the resilience of the communities. And through that, we saw improvement in acute levels of malnutrition. And similarly to Isiolo, it improved from 17.8% to currently 13.7%. This is a quite good improvement that we recorded over this period of time. Despite the hard challenges that we saw, the concerted efforts, the collaborations and partnership enhanced these results. Please go to the next slide. Can you move to the next slide? Thank you. Okay, what are the success factors? I have mentioned this: enhanced multi-sectoral collaboration and partnership. We saw engagement, multi-sectoral engagement during this time, where it's led by government, and these enhanced interventions, efforts to put resources together, and based on the government priorities, we were able to respond to situation as it was. As I earlier highlighted, it was a difficult time, but we indicated improvement over that period. Effective utilization of resources, where now it's a difficult time and the resources are not that enough, but based on our surveillance and data, we were able to prioritize areas where need urgent response, and through that, we had effective and efficient utilization of resources, where the population that really needed are the first that are prioritized for interventions. And through this, and all of these formed part of advocacy. The data that are being driven is being shared with all the stakeholders. Regular engagement among all the stakeholders within the county that are responding to emergencies at that particular time. And also coordination from the government enhance this effort. Co-funding of activities. For example, in areas where we are unable to reach with services through the government system, we had the complementarity of other partners within the county who came on board. And one partner could fund one circle of integrated outreaches in far-flung areas where they are not accessing services. They are situated more than 20 kilometers, more than 50 kilometers from health services. Through co-funding, where resources are being pulled together and we were able to give services. Where a borehole during the acute shortage of water during the drought, one partner could dig a borehole, another stakeholder comes in and do piping of that piping of that borehole, and to help that community access water services. And another success factor is bills and policies and frameworks that is for the government. For example, earlier mentioned County Integrated Development Plan is one of the documents that is used by the government for planning, and it helps in layering out or showing where the government priorities are, and this helped in giving us focus. And integrating the nutrition actions in this County Integrated Development Fund is one of the achievements that we have seen. And also Community Health Service Act, where the community health service, the communities are being empowered, that in a village there is a community health assistant, an extension worker who work within the community, and this is enhanced through availability of policies at a local level, through the collaboration, and this enhanced also resource availability, because the government is mandated to give resources to these activities through such policies. World Equitable Development Fund, this is a lower sub-county, lower than even sub-county level, where now there is a development bill at the county level, and this bill unlock resources for the local communities where the activities can be run at that level, and others, including early childhood development education bill, where the government is mandated to give funding for nutrition, including a school feeding program at this level. And if this bill and frameworks could not be available, the government could not be, have that mandate to give service. And through this bill is also and the policies and the framework is also an advocacy tool for us, because we use this to now highlight the needs for the local communities and the need for allocation of resources at this level of the governance. And also integration of nutrition activities in annual work plans for the departmental level of different sectors across education. There is school feeding program laying out the key activities for nutrition in that sector. How can we enhance food system at the community level through availing or accessing water at the community level? Capacity strengthening initiatives such as multi-stakeholder platform for nutrition. This is one of key coordination platform at a county level, and capacity building the stakeholders, members of a multi-sector platform for nutrition. Capacity building the members of county assembly who have the capacity to legislate and ensure that this sector is taken care of at the local governance level. And also the political goodwill, leadership, involving the leadership of the county at the local level, including them in having them understanding the nutrition agenda at the county steering group coordination meeting, where this is one of the coordination meeting which is chaired by the head of the government, the governor at this level, and also in absence of the governor, the deputy governor, and also or a representative of the national government, the county commissioner. When these issues are being brought at this top level of leadership, it enhances also allocation of resources, unlocking resources for responding for nutrition interventions. Thank you. Next. Despite the advocacy, because of other competing priorities at this level, including infrastructure development. This is one of the area, as highlighted earlier, with a very low resource setting. Still the government is building schools, the government is building roads, the road networks are still challenging. Still the resources are inadequate, and it is being also sub level of governance in Kenya, county government. There is also delayed disbursement of government funds from the national government to these levels of governance, and also high cost of program implementation. These are arid and semi-arid area where Marsabit lies. These two counties are huge in terms of service area, very vast geographies, challenging terrain, poor road connectivity, communication network, and also the population are sparsely distributed within the communities, and the cost of implementation of program is so high. What are the lessons learned? As indicated earlier, surveillance is one of the key things for us here, and we have used it for advocacy, data-driven advocacy, where the new evidences that comes from our surveillance inform decision-making. As indicated, early warning information help us to do anticipatory planning in a scenario. In the next 3 months, this happens. What do we need to do? And this data is being shared with all the stakeholders, including government, for resource allocation, and it helped us in response actions. It helped us to do an efficient and effective response that has yielded us good results, as we indicated in the results. Continued engagement with top leadership also enhanced political goodwill, leading to support for nutrition activities, multi-sectoral nutrition coordination mechanisms. Through engagement with different sectors, education, water, agriculture, the partners within who are also complementing the government efforts, is one of the things that we have seen. And also such a forum, virtual forum engagement, help us to ensure that we have regular engagement. With the outbreak of COVID-19 came in use of this virtual engagement, Zoom, Google Meet, and other virtual forums that we used so often because it's also we need a little resource to meet from different end with little convenience. So it helped us to do regular coordination meetings. And also at the county level, the county steering group meetings, county nutrition technical forum are key in terms of enhancing partnership and collaboration between different partners at this level. Key recommendations is continuous capacity support to improve advocacy. It's necessary. We need to still do capacity support for multi-sectoral coordination networks at this level to enhance resource mobilization skills for the stakeholders and do mentorship and accompaniment at this level. And also institutionalize multi-sectoral platforms as indicated, the multi-sectoral platform for nutrition, county steering group, nutrition, county nutrition technical forum, sub-county nutrition technical forum, and even at the community level, where community can sit and and also prioritize their issues during public participation, which the government usually conduct. Government give power to the people because the power lies with the people. So if this community is empowered and they know what they really demand at that lower level within the community, they can very well do it. So it's necessary to institutionalize these coordination forums and also ensure that the coordination forums are also available at the community level, and it's being adapted and and it continues working. And also we saw that bills, policies, and framework for the government is essential to avail resource from government and also ensure that the government priorities are also being prioritized by other stakeholders within the county. Having plans for the government within the government document and setting it right and saying this is the government priorities, and also layering it there and having the complementarity of other stakeholders, it enhances efficiency of service delivery and also impact for the community. So finalization, we have policies that are not final and not yet operational, but we have started it off, like Marsabit County Food Security and Nutrition Policy, which is still in draft form. So finalization of this document is very essential because it gives mandate to the government to allocate resources and spend it for nutrition activities. Thank you so much. Thank you to organizers of this forum. It's a great platform and giving us an opportunity to share an experience from even this local level. If there is question, I will respond it at Q&A session. Thank you so much.
Thank you very much, David. It was very comprehensive presentation.
Yeah,
I'd like, however, to remind.
Just to sorry for interrupting. Just to appreciate the partners who worked with us during the experience that I'm sharing. These are the partners. We are very grateful for the contribution and the support that we had at the local level. So thank you so much.
Thank you, David. We will move very quickly to the next country, and thank you for sharing that experience of Kenya's counties with multi-sectoral approaches to research mobilization, which are a unique experience other partners can replicate. We'll now move to Uganda, and I'd like to invite Georgine Obwana, Senior Program Officer at the Civil Society Alliance for Nutrition in Uganda, to take the floor to share Uganda's experience. And I would like just to remind you to please keep your presentation within 10 minutes. Otherwise, we will need to cut you and proceed with the next segment, as we would really like to have enough time for the Q&A, as this will be an opportunity for partners to ask questions and share contributions. So over to you, Georgine.
Thank you so much, Steffi. Good morning, good afternoon, and good evening to everyone who is joining in for this webinar. It's really a pleasure to join in and have a word and share with you a bit of experiences right here from the Civil Society Alliance of Nutrition Uganda. It has been mentioned earlier. My name is Georgine Obwana, and I work for the Civil Society Alliance for Nutrition Uganda. And this is currently, I'm speaking right from Kampala, very cloudy space. The civil society, briefly, of Uganda, in short, we call it CISANU, brings together a number of non-government organizations, CSOs, and about 35, and we come together for one cause. So today I'm going to talk to you about strengthening nutrition through strategic resource mobilization. And it's just an experience of Sisanu's journey in advocacy and support. So through this process, we've been able to do a number of things, but I'll share just three of them. And one of them is on leveraging the work of the network, because a number of organizations come together with a diverse group of people, women, youth, and children, plus persons with disabilities. So we've tried to use their expertise to be able to leverage resources that are being used to implement a number of projects under the CSA. We've also engaged a number of key stakeholders in this very network to be able to push for policies around and be able to have practices that I'll be mentioning on as I move on. But also through this very network, there has been an opportunity that Sisano has really enjoyed. And I'll say this is a great one because we've had to have an opportunity to build alliances with other non-government organizations around CSOs groups as well. So it has learned a lot of best practices from them and been able to combine efforts and also pull resources together to push for the cause of ending malnutrition in Uganda. Secondly is on the aspect of earned media. This has been our strength for a very long time, and we've been able to build a very strong relationship with the media. I know with advocacy, you can really truth on this is that you cannot do advocacy without the aspect of media, because then you need to show your work out there to the people. So bringing in the media from right the planning stages all the way to the implementation of the projects has been really great, because then we've earned their trust and support, but also have been able to have issues being put out there concerning nutrition in Uganda. And we've gotten the attention of policymakers because of the constant reaching out to them with information and having to have them revert on that. But also we've been able to foster rather public support, which is a great thing. And this has brought me into the aspect of accountability. So we've held each other accountable, both in the network, but also those in pushing in for the policies, the policymakers, and we've been able to have sit down and discuss all this through, because then we've heard the media put out issues clearly and being able to feature a number of issues in the communities, and this has brought policymakers onto the table. Thirdly, we've also had funding. Now, this is the aspect of the money bit of it, the cash bit of it. We've secured grants through this way, and the most that we've heard is one that we got from the Gresham Marshall Trust Fund and the Population Action International. And this pushed a very interesting project that we heard in hard success that I'll be mentioning forward. It was on advocating for implementation of the commitments for the Uganda Nutrition Action Plan. So we had to do that specifically on breastfeeding, iron intake, but also on vitamin A, because we thought these are the key things that affect a very critical key population in our country, and that's the women and the children who are measured. Like you look at the women, they contribute to almost 80% of the workforce in Uganda. So having them healthy directly contributes to the workforce in the country. Next. Next slide, please. Oh, thank you. So for the key results into our initiative, there are a number of them, but one of the interesting parts is that we've been able to have a number of organizations with similar thoughts. That's what I'm saying. In the calls for ending malnutrition in Uganda, being able to come together, declare, but also sign. That's just like a commitment to advocate for particularly this implementation of commitments and that have been listed in the Uganda Nutrition Action Plan 2, which is coming to an end right now. But majorly it was on breastfeeding, iron and vitamin A. But what's really was the highlight of this point was that majority of organizations and stakeholders were able to have a work plan and include this into there, but also craft a budget for pushing this cause forward, which was really a great thing. But also having momentum for a private members bill on food and nutrition security PCAP in the country. This bill has been stalling for since 2008. You can imagine how many years. But then after coming on with this very particular project, there's been momentum. And right now, as I speak, we've had 3 consultations, but I bet by January we'll have the first draft being tabled in Parliament. And Susan is really part of the team pushing for this. Also, we've had a very high interest from the media on the nutrition agenda in the country. I believe they've appreciated the aspect of getting to understand that nutrition affects everybody and cuts across. It does not segregate. So then having them on board and getting them to be interested through furnishing them with information all through from the planning stages and getting them to be ambassadors to champion nutrition in Uganda has really been great. But also this has translated into a way that there have been donors that have seen this, then they've come on board to put in resources in one way or the other. For success factors, there's been a number as well. Clearly, stakeholder engagement has been key because then we've involved a number of stakeholders right from government, the policymakers. We've heard civil society itself, youth, the young people. We've heard women, persons with disabilities. A broad spectrum of stakeholders have come together and we've engaged them into this aspect. But this has also created a pool of expertise, knowledge, but also funds. And then building synergies. We've not been able to work independently as a silo. No, we've worked with a number of organizations. And also for the resources, it has also come from a number of organizations that are part of the CSA network in Uganda. So building synergies has been also great. We've also had robust media mobilization because we believe media, with advocacy and having media on sport, then you're able to share information. And that's where the aspect of documentation comes in. You're able to be seen, the cause, the issues are able to be spelled out and understood by the people. And then that's where the effect comes in and there is impact in the end. For resources, including money and other useful inputs, we've also taken advantage of that so much because then it's not strictly that money. We've also had time, media time, where we've heard to speak in media spaces, like those traditional mainstream. We've heard situations where we've had policymakers have created time to be able to come and just dialogue and be able to understand each other on a round table before then we can present these issues on to the larger part of the country. Next slide. Okay, it doesn't go without saying that there has been challenges that we've faced, and I think this is quite a number of challenges that affect. And for the first, a shrinking space for CSOs to operate, especially due to the increased bureaucratic operational requirements for those in the African space. This shouldn't be something that is new because the shrinking space comes in with a lot of technicalities and the bureaucratic processes you can understand with governments and how they operate. It takes a lot of time, and time is a resource for that matter. So it really hinders the aspect of resource mobilization, but also the impact on advocacy for better nutrition. But the aspect of weak multi-sectoral coordination, this is very clear. And in Uganda, this has been a situation for a very long time, spanning decades, where we have a number of champions coming up or ambassadors. But then because of the reshuffles, you know, how government operates, you're taken from one office to another. You have new stuff every time. So these people come in with different mindsets. They may not be really up for the cause that you're pushing for. So that does not give them the energy to be able to push for what had been created initially. So it's often 2 steps forward, 1 step backwards in that aspect, which becomes a challenge. And then the multiple strong interest of donors. Yes, this is a very interesting one. Here you have heavily funded groups coming in and pushing for certain particular, you know how it's very specific cause, but then leaves the bigger agenda that does bring impact to the bigger population. So this is also one of the things that affect. So there's no way you can fight that, but the only thing that we've tried to do here in Uganda is by trying to come together, integration, and being able to work in the same space to be able to push for the same agenda. Listen, learn to a number of them, but leveraging resources from partners has been the greatest strength that we have seen from especially our members. We've been able to use resources from organizations within the network to work through this, but also working with media to create awareness has also been a very important thing that we've learned. We could not do without media. But research. A lot of we mentioned on data evidence advocacy, and that's what we do. We've done a number of them. We've done publication. Probably you could be able to see online on the research that we have done. And lastly, on the recommendation quickly. Oh yes, I'll speak about two majorly of this one, and that is on engaging operation research. Yes, just as just said before, it does help a lot because then you're able to articulate what you want to the donors, and that's where they come in with support in whatever way. Also, building relationship with donors themselves, timely availing information timely to them, so then you're able to understand each other and what you want at the end of the day, and then continuous media training at the end of the day, both the digital but also the traditional, because you need them for your advocacy as you move on. And this has been able to equip, for instance, the CSA with a lot of support. There's been accurate and up-to-date information from the media, and they've been able to get problems from the ground and feed into ours, and we've been able to know and go and really deal with them. So with that, thank you so much for listening. I'll be available to return to any questions that will come forth. Thank you. Over to you, Steph.
Thank you very much, Georgine, for those very useful recommendations from Uganda's experience, particularly building strategic partnerships with the media and using both traditional and non-digital and digital media to influence policymakers, which are very important to advance the nutrition agenda. We'll now move very quickly to Venezuela, which is the last country in this segment. This presentation will be done in Spanish, so participants can, when the translation can switch to the English channel. And I'd like to give the floor now to Dr. Maria Teresa Nordello, Health and Nutrition Coordinator at the Civil Association for the Promotion of Popular Development in Venezuela, o Asociación Civil Fomento del Desarrollo Popular, FUDEP, en español. María Teresa tiene la palabra. Adelante.
Thank you. Thank you very much. And thank you very much for the invitation to this webinar. I am a doctor. I graduated 35 years ago from the Central University of Venezuela. And I am working right now in my organization, which is the Civil Association for the Promotion of People's Development, for the last 17 years. When projects were already ongoing, projects related to nutrition in the framework of social accountability for private companies or corporate social responsibility. Based on the complex humanitarian crisis happening in Venezuela, we started for the last 6 years with humanitarian projects. So my organization for the promotion of people's development has been legally established 34 years ago, was established by 3 missionaries. And my organization, the goal is to fight the structural reasons of poverty in Venezuela, giving responses to the basic needs of the population to contribute to social change. Of course, contributing to social justice for the majority. In this organization, it was founded by 3 women. most of our staff is still women, and we are very proud of this. So we're going to talk about the strategies implemented by organization FUDEP since 2018 until now in the south of Lake Maracaibo in the state of Zulia, which is one of the states have been prioritized by the different clusters in our countries. It is a border state. It borders Colombia. And of course, there are different particular situations happening in this area. In this state, in the south, we work in the municipalities of Catatumbo, Centrum, Perija, and Colón, with a high level of indigenous population. With these interventions, we have been able to serve the population in terms of nutrition, health, water access, sanitation, hygiene, food security, and livelihoods. Most important, perhaps, is to highlight that in 2018, we started with a nutrition project. And based on that, and with the nutrition component, we have been able to determine the context of the needs in this area, this border area. And this has allowed us to create projects that can respond to the needs of these groups. Regarding key results, and this is really a reason to be proud, we have verifiable information on the nutritional context of the entire intervention area. We have key community actors. We have raised awareness among them in nutritional issues, and this is evident in the general population because we have seen improvements, for example, in practices in terms of nutrition. And we have been able to see a faster, more sustained recovery over time of children younger than 59 months and women in breastfeeding stage who have recovered a nutritional therapy. Success factors to be able to attain these results is that FUDEP has worked in an articulated manner with partnerships and alliances, and of course with a localization strategy. We use local talent. That is, we try to have all of our staff in the projects developed in these areas to be local. And we have conducted identification and sensitization or training of these actors in this community, where we have implemented the initiatives in communities and with an emphasis on local governments in educational centers, healthcare centers, indigenous authorities, among other institutions that we have been able to contact to raise awareness and provide training. And this nutrition component comes always in conjunction with other key components, which we have realized that there are key, that are very important to attain a faster, sustained recovery. So we're talking about health, wash, sanitation and hygiene, protection of food security and livelihoods. So what are the challenges in this area? This is a high vulnerable area, especially for climate-related catastrophes or phenomena. For example, in two situations which are drought during the dry season, we have droughts and floods during the rainy season. There are armed groups who control the territory, and there's also presence of drug dealing gangs. We have also evidenced human trafficking because this is an area where they can cross the border. It's a very permeable border. So these are remote areas with difficult access from any point of view. There are no airports. You have to go to neighboring states and then transport or transfer by land. There's a deficient access to telecommunication services and very deficient specialized healthcare services, nutrition, and mental health services. So a fourth challenge that is not on the slide, but I think is also very important, especially as a local organization, is the financial challenges. On many occasions, we have seen how monetary funds are very difficult to reach our organizations, and this can lead to delays in the activities and, of course, in meeting the deadlines and the landmarks of the interventions. What we have used, what we have done to be able to combat or tackle these challenges, and which we recommend to our partners or members of other organizations, is a prevention and mitigation strategy, disaster mitigation strategies, especially when we work with the water sanitation and hygiene in this case. For example, we tackle the issue of droughts with the drilling of water wells. And we also have trainings in strategies of what to do, for instance, when we have floods. So, for example, we have local partnerships. We get support from local organizations when we work with local talent, and this helps us provide early warnings about the risk also of armed conflicts. And our transportation, land transportation, we do it with local, reliable local providers for the team and also for the transport of supplies that we use for any implementation. We do it with very low visibility on a low profile. Sometimes we've had, in the case of telecommunications or to improve the issue of telecommunications, we have to, or going to the places of the intervention, we do it with specific telecommunications companies of the relevant country, working directly with telecommunications companies from Colombia, for instance, which have a better reach in these areas, although they might be in Venezuela, and always trying to ensure provide access to other health services, for example, mental health services. We were lucky enough that we've always had a specific fund, a savings funds for the organizations for social contingencies. So even before the crisis and even before these humanitarian projects, these funds were used for other contingencies, but now we've been able to use them for a financial contingency wherever we don't have the resources on time. So, and we do this, we use this to buy medicines or treatments, so the start of activities of the initiatives are not delayed. So, and I think this is it's a good practice. The fact that we're able to, all organizations should have this type of funds. I think it's a best practice. I think this is all on my part for this presentation. I hope that I have met your expectations, and I thank you. I thank the organization and the participants. Thank you very much. Thank you very much, Doctor, for sharing the experience of Venezuela. We will have some times to share experiences in the Q&A. We'll go to it right away.
So I'm going to switch to English now, and we're going to open the Q&A very briefly as we are running over time, but we would anyhow like to take this opportunity to open a space for exchange. So I am going to hand over to my colleague Marie, co-chair of the Advocacy and Communications Working Group and Communications Consultant at the GNC Coordination Team. Over to you, Marie.
Hi, Steffi. Thank you very much. And thank you to all of the panelists. Wonderful presentations. So really appreciate it. I will keep this very short so we don't go over time much. Any questions that you all may have that you didn't have a chance to add to the Q&A, please feel free to email us and we'll make sure that we get those questions answered and shared with all participants in this webinar today. It looks like from the chat box, we have one question actually by a panelist that I will go ahead and flag with Georgine. I will go ahead and ask you the question though that was asked by Abdul, but we're interested to know more about how media is used to increase visibility of local actors. Great question, because I think this is something that actually can be transferred to all regions and all contexts. So go ahead, Georgine, if you'd like to answer that question.
All right, thank you. Thank you so much, Marie. From the perspective that I've heard here in Uganda is that we've heard media from the grassroots and we've been able to have them join the advocacy space right from when we're planning, for example, if it's a project. So we bring them in not to cover the story, but to be part of the story, to be part of the initiative or part of the cause. So in that way, they're able to go out there and articulate to the public according to how they've understood the cause. So with this, then they pick the interest to be able to be part of it. So through visibility, they will be able to share the pertinent information or what needs the key takeaways or actions that needs to be communicated to the public or the specific policymakers on that. Thank you.
Great, thank you, Georgine. Appreciate that. And again, just to remind all participants that the Q&As that are asked today and answered, we'll make sure that we get those over to you. So we have that all in writing. It looks like we don't have any more questions. And again, as I mentioned, please feel free to email us any questions that you have after this, after the presentations marinate for a while, and perhaps you need to see the presentation again. But thank you all, and really appreciate it. I'll go ahead and pass it back over to Steffi to close us out today. Thank you.
Thank you. Thank you very much, Marie. And I'd like to thank this now our guest speakers and participants for not joining us today. We have reached the end of our webinar. We're going to share the recording and presentation of the session today in the next days. And right after we finalize the webinar, you're going to have the opportunity to share your feedback. We'll have a very quick survey. Please feel free to do so. We will also email you this on the email that we will be sending with the resources of the webinar today. And we really appreciate your the feedback and contributions that you can share for us to improve our upcoming webinars. And thank you very much again. And wishing you also a very good end of the week and best wishes for the holiday season. Thank you very much.
Thank you too.
Thank you.